Hey, good morning, Casey, Hector, and Scott. Good morning. So here on another beautiful Friday at the Oxford Exchange, and today wanted to talk about a really important subject that we have conversations about this all week long. We should take some time and embellish this subject and kind of dive into it. So when patients come in for a cosmetic consult, Hector, and they're wanting to do something with their smile, we put their photo up and we say, give me a punch list of some of the things that you want to improve on. And almost always, the number one thing that they want is color, right? They want whiter teeth. And that always disappoints me a little bit because I know what the next challenge is going to be. It's like, gee, if I'm looking at a smile and I see all these different things in my head of design elements, and I do mean design elements that we're highly trained as a cosmetic dentist in achieving, so we know we're going to have a harmonious smile. Color is one small part of it. But because the patient doesn't have the trained eye, what they think is holding them back is color. But the interesting thing is color is the easiest thing for me to change as a cosmetic dentist. It is and it isn't. Because what I'm thinking is this patient looking for a smile enhancement or are they looking for a smile makeover? So in other words, a smile enhancement is more of a local problem. A smile makeover is a global issue. So let's talk about that. Let's just say that I'm looking at the patient and then in their head, they are not happy with their smile because the main actors of the smile, which are what teeth, Hector?
Centrals.
The centrals, these two teeth. I say they're the main actors of the smile. And the two teeth beside them are the supporting actors. Everything else besides that is gravy, really. So a lot of times we look at the patient, if the main actors are down, you got a chip on the very front one, or you got one that's dark, you have one that's long and one that's short, or they're crooked. We have no chance. I look at the patient for years and saying, our main actors are down. We need to fix the main actors. That is a smile enhancement. Well, we go to do the main actors, and guess what they want to do? Can we make these white? It's easy for me to do, right? But not responsible for me to do because I don't want them walking around town and you have two really white teeth and the rest of the players are another zip code. It's like, please, let's not do this. I want to enhance your smile at a reasonable cost, and it's going to change your life. Two teeth, we get the main actors right. It changes your life. But if we're not educated in how we're going to do this and we're thinking it's all about color, because usually we get in the middle of the procedure and they go, listen, can we make these 3 shades whiter? Why? Because, of course, they're thinking, we're going to whiten the rest of the teeth to that. I know that there's some of that we could do, but it may not be sustainable, and it also may not be possible. Because again, in the picture in the patient's head is, it's going to make my smile a lot better if we make it whiter. And we see it everywhere. It's a pandemic. I see great looking people walking around with their 2 front teeth that are 3 shades lighter than everything else, because the dentists have been forced to do that. So that is more of a local issue, but we have to blend to the existing smile and color that you have. Or let's just say that the front 4 teeth have some problems because you have some old dentistry there and staining in between the teeth. That is a situation where now we're going to change the main actors, not only the 2 center ones, but the 2 beside them. And we can achieve some great things as far as enhancing the smile. But in that situation, we may be able to get away with 1 shade lighter, but not 2 to 3. because now it's going to stop as soon as you get to the corners. And even with whitening, we can't make up 3 shades. Not typically and not sustainably, because remember, these crowns or these veneers that we're going to place, we expect them to be there 15, 20, 30 years. The other teeth are not, those are not going to change shade, but your other teeth are going to go down in shade. So that is something to think about, because that is saying, if we're looking at this patient and they truly do just need a smile enhancement, that is, the color of their teeth is in range of what I would consider a natural nice shade, which brings us to the next topic of a smile makeover. So for a smile makeover, typically the biggest thing that's off with a smile makeover, we know it's not just changing the front 2 teeth or changing the front 4, is when we have a global issue. So a global issue is if the arch form is off, or the proportions are off, or the arrangement is off, or the gum line is off. So this is the patient where in their head they're thinking again that whitening is going to change it, but I look at it and say we have 6 of the 12 design elements that are off. And for me, just to change 4 teeth is not going to give them the smile of their dreams. This takes a deeper conversation, and it takes more time to help the patient realize how we can truly change their life by doing this on a global scale. So sometimes you look at the patient and they're smiling and they say, I don't show enough teeth. That can be an arch form problem. The teeth on their side are caved in. They're kind of going like this, as opposed to a Julia Roberts smile, when they smile when it's really wide. That takes a little bit more planning of how are we going to not only enhance the smile, but how are we going to make the smile over? Let's just say in that case you might want to do Invisalign first, build the smile out, get the teeth in the right place, and then do veneers. And in that case, if you're doing 10 teeth, now you can have a little bit more freedom with that shade, because now we're doing 10, so now all 10 teeth that show, and typically it is 10, right? Because when you smile, patients think you're just seeing these 6. You see more than that. We call them the cocktail teeth, showing from the side. So those usually involve 8 to 10, and then in that case we can push the limit on color a little bit, because now we just have to blend to the lower, whiten the lower, and pick a shade, maybe 3 shades lighter. So that's a smile makeover that involves where I have control over many elements of the smile design. So we talked about the arch form. How about arrangement? You've got teeth that are different angles. You have one that's this way and one that's this way and one that's in this way. We just saw that this week, right? In that case, again, it may take putting them in place with the Invisalign, getting that set, and then at the same time, because I have control of 10 teeth, I can kind of do some instant orthodontics. So if I can't do it all with the Invisalign, but get it close, so we can do more conservative preparations, but it doesn't take as long as Invisalign if I can take control of some of those other things when I reshape the teeth, right? So if it were just a pure Invisalign case, it may take 18 months, but if it's an Invisalign with veneer enhancement, you can do it in 8 months and get a better result. So the next level of maybe a design element is off. What about the gummy smile? Somebody smiles and it's like they have very high lip dynamics. So we're looking at the lip dynamics when you were doing a video of you and seeing how high your lip goes up. Not when you do a fake smile, but when somebody tells a really good joke and you're like, and you're like showing everything, right? Some people do, and their lip goes way up. In that case, I'm looking at it, and I'm not looking at it like, boy, we can't get there from here. My brain is thinking, we need next level on a global type of strategy, meaning we may have to lift the gums, make the teeth longer, have the white fill out more of the face as opposed to a disproportion of pink, meaning the gum, and not enough presence of the white So we balance the white into your lip, into your face, and now we have a design element that's a game changer. You look at somebody who has that issue, and if they're trying to fix that issue in a way that isn't adequate, they're going to spend a lot of money and get to the end of that and be unhappy. So I think you get the sense of the difference between a smile enhancement versus a smile makeover. And this is what you really want your cosmetic dentist to be able to do for you. Architect that smile. It's a smile architect. And the great thing now is we have so much digital technology that is helpful. So in the beginning, when I started doing this in the year 2000, we had these computer simulations. I never liked them because it's like you're pasting in somebody else's teeth into somebody else's face. I looked at it and it smacked of something that was not authentic. And first of all, it didn't look right. And secondly, it's like, can I do that in your mouth? Whereas now what we can do is we can do it digitally and plan it and test it in your mouth. And this is called a mock-up. So the mock-up is where you come in, we take the video, we analyze the video, we take some digital scans, and we digitally scan and plan your smile, changing the smile elements of proportion, shape, length, width, arrangement, amount of gum tissue, and we get the ideal smile. And then we do a 3D print of what that would look like, and then bring that to the mouth in acrylic and try it on and do a trial smile. Now we take a video of that and see how you look in a trial smile. This is something that you want to take advantage of. Because when we see the trial smile, we start salivating because we're like, this we know we can do. And you look at it and you will feel very confident in choosing this treatment for yourself because you know it's going to be worth every single penny and you're going to get your return on investment every time you smile, which is going to change your life. It changes the way you react with people, the way people react to you, and you can go through the day with confidence. And so this is the biggest thing that we work on is the trial smile, and know that the global issues we talk about, once we're able to achieve those, that's going to give you the smile that you think about, that you see in pictures. And it's a very predictable way to go about having you make this investment, knowing it's going to be worth it, and knowing that we can produce that in your mouth. So this is something you want to ask your dentist about. Can I have a trial smile? Can we do this digital mock-up? Take advantage of the technology. We've invested in it because it makes a difference. We will not invest in a lot of things that are all fluff and no substance, but this is something that I think that you should check out. And keep in mind, if you just want a smile enhancement for now, keep the cost down. Smile enhancement, $6,000 to $8,000 for 4 teeth, right? A smile makeover, it's a lot more than people think, 25 to 30. But that type of investment changes your life.